And when these patients come to me, I quickly realize that they are doing so many things wrong when it comes to their nutrition, putting themselves at danger. So before it became your favorite influencers and actors, medicine, GLP-1 is actually a naturally present hormone in our body. Thanks to these medications, people are able to eat very little amounts without major discomfort. You might have diarrhea, constipation, nausea, dizziness, but there's also a few side effects that, well, for some reason the companies selling these medications have not mentioned initially. Turns out multiple studies have shown there is an increased risk of disease, cancer, if you're taking peptide on the black market. Well, good luck. 25 to 40% of weight lost by patients was lean mass. Alright, picture this. Imagine that you're a doctor in New York in the early 1990s. Every day you see patients struggling with diabetes, blood sugar levels are high, medications only do so much, and finding a better treatment to help them feels like an uphill battle. That doctor was Dr. John Eng. For over 25 years at the Bronx Veterans Administration Medical Center, he treated thousands of people with diabetes and other hormone-related diseases. But when he wasn't at the clinic, he was in the laboratory, studying something that, at first glance, had absolutely nothing to do with diabetes. He was studying the venom of an endangered desert lizard called the Gila monster. Now, most people looked at this slow-moving reptile as just a venomous lizard. John Eng saw a scientific discovery. As he analyzed the molecules hidden inside its venom, one particular compound stood out, Xandin-4. At the time, nobody really knew that this venom would actually lead to one of the biggest breakthroughs in the treatment of type 2 diabetes and obesity. In fact, that molecule from the lizard's venom would then become the blueprint for medications like Ozempic, Wegovy, and other GLP-1 receptor agonist medications used by millions around the world today. Hi, I'm Mael. I'm a nutritionist working in New Zealand. I've got a master's degree in advanced nutrition practice. And why I'm making this video is that over the last few years, I've come across more and more patients taking these medications and even peptides on the illegal side of things. And when these patients come to me, I quickly realize that they are doing so many things wrong when it comes to their nutrition, putting themselves at danger. So through this video, I want to educate you on what these medications do, the potential side effects coming from the medication itself, but also the potential side effects coming from the diet surrounding the intake of these medications. Now let's start with GLP-1 and understanding what it is actually. So before it became your favorite influencers and actors, medicine, GLP-1 is actually a naturally present hormone in our body. It's called glucagon-like peptide 1, and this hormone is secreted by the cells of our intestine and pancreas upon sensing glucose, so carbohydrates, in our mouth and our gut. When this hormone is released, it will then travel throughout our body and bind onto receptors present on muscle cells, gut, liver, and even the brain. Once it's bound to these receptors, it will then trigger mechanisms that are very important for us here in terms of type 2 diabetes mitigation and weight loss. The effects of this hormone will be slowing down of gastric emptying, which is slowing down the travel of food from your stomach to your intestines. This means food sits in your stomach for longer. It will also reduce appetite through signaling to our brain. It will also increase the secretion of insulin. Insulin helps uptake glucose into our cells and reduce the secretion of glucagon, which counteracts insulin. Glucagon breaks down stored glucose, also called as glycogen, into glucose and releases it into the bloodstream. Now that we know this, you could think, well, why don't we just take GLP-1 as a supplement? Why do we have to take a completely different drug such as Ozempic or Wegovy? The thing is, this naturally occurring hormone only lasts about 1 to 2 minutes. Here I want to introduce to you the concept of half-life. Half-life, when it comes to medications and molecules, is the amount of time it takes for something to get broken down into half of its amount. So for example, if we had 100 grams of GLP-1 being secreted in our body, well, a 1 to 2 minute half-life means that in 1 to 2 minutes, only 50 grams will be left in our body. And then 1 to 2 minutes later, only 25 grams will be left. That poses a problem when it comes to making a medication when it only lasts 1 to 2 minutes. This is where the work of John Eng comes in pretty clutch. John Eng found this molecule called exendin-4. This molecule is particularly interesting because it mimics our own GLP-1 by binding to the receptors. This is called the GLP-1 receptor agonist. It triggers receptors, but it gets broken down much more slowly than our natural one, roughly 2 hours. Initially, people didn't really care at the time of his discovery, but he believed in it, he patented it, and paired up with pharmaceutical companies to then make the first ever GLP-1 medication in 2005. Later on, we had other companies jump on the train, develop their own medications with much longer half-lives, ranging from 10 hours upwards of 100 hours for semaglutide, also known under the brand name Ozempic. Recently, in 2024, we've had Eli Lilly work on a newer generation called tirzepatide, which is meant to be even more potent than the older generations. And in 2026, Eli Lilly is also working on an even newer one called retatrutide. Remember this name because we will talk about it later in this video. Let's dive into the actual subject of this video. Weight loss medications are effective at treating type 2 diabetes and weight loss, without a doubt. In terms of the weight loss, this isn't some kind of magical thing happening here. We've said that GLP-1 reduces appetite and slows down gastric emptying, which further reduces appetite because you've got something in your stomach and you're not able to just munch away on your next snack or meal because you're still feeling full. This means that overall, over the day, medications decrease your overall calorie intake. So we go back to the golden rule of calories in, calories out. You eat less than what you expend. This is basically the sole mechanism through which GLP-1 medications are working. Okay, so we know that they work, we know how they work. My issue here is the nutrition around taking these medications. Now, I don't want to put the blame on patients taking these medications. You know, the companies are selling them these medications. Those medications don't come with a meal plan. The GP, it's not his job to cover nutrition. When people take these medications, this is often their last resort. They have had a lifetime of trying to lose weight and have struggled the whole time through natural means because of poor guidance from people around them, and now they have resulted onto this medication. So once you're taking the medication, what is my issue with the nutrition here? So by artificially suppressing your hunger thanks to these medications, people are able to achieve very fast weight loss, but also eat very little amounts without major discomfort. When you go about to calorie deficit naturally, you will often feel hungry no matter how reasonable you are with your calorie deficit. Whether that's a 300 calorie deficit or a 500 calorie deficit, you will still feel hungry to a certain degree. Now, you have to push through this through willpower and use of 0 calorie snacks and high volume, low calorie meals and snacks, artificially sweetened beverages, 0 sugar gum, artificial sweeteners that, I don't know, you might use on popcorn, for example. This is a standard snack that I recommend to my patients trying to lose weight, is taking popcorn, which is a very high volume, low calorie snack, add some artificial sweetener to it, and boom, you're away with a nice yummy snack that doesn't have many calories. While these work very well, but obviously it's much more simpler when your stomach is not screaming all day long for food, which is what the medication does. But see, when you're artificially suppressing your hunger, you don't have to ask yourselves all these questions. Patients taking GLP-1 medications do not know what to eat while taking the medication. They think that just simply not eating a lot will lead to weight loss, which it does, but what about the other consequences? Let's talk about the side effects, both caused by the medication itself, but also by the lifestyle surrounding taking these medications. First, the medication itself. If you're taking it, you might have already read on your morning pamphlet, you might have diarrhea, constipation, nausea, dizziness, but there's also a few side effects that, well, for some reason the companies selling these medications have not mentioned initially, which is causing them a lot of legal trouble at the moment in many different countries with a lot of lawsuits happening. When I was doing research for this video, I came upon a very interesting meta-analysis of a randomized controlled trial on the different weight loss medications that we see at the moment. Turns out multiple studies have shown there is an increased risk of gallbladder disease, injury, and maybe even cancer for some of these medications. That is not benign. Now, I'm not going to cover any more of this because this is up to your doctors to help you navigate these risks. Obviously, if you're taking peptide on the black market, well, good luck. But what I can talk about is the nutrition related side effects that one might encounter upon taking these medications. The first one will be extreme muscle loss. In controlled trials, they have found that roughly 25 to 40% of weight lost by patients was lean mass, meaning muscle mass. Now you might think that's not a whole lot. Well, this is in controlled settings. Researchers, they have instructed patients on what to do and how to take. This is maybe even the best case scenario. In real life, you see patients able to withstand 1,000 calorie diets thanks to the medication, which leads to drastic weight loss, which will be paired with drastic muscle loss. See, in a normal consult with a patient trying to lose weight, I will often recommend them aiming for 1, 2, maybe 3% of their total body weight lost per week. For a 100 kg person, that might look like a 1, 2, or 3 kg lost per week, depending on their starting body fat levels. Usually, this is easily done through 500, maybe 600 calorie deficit. In a month, a 100 kg person might have lost 4-6 kgs, which I would be very happy with, and the person working with me would also be very happy with. This, I guess, slower rate of weight loss comes with one good thing, and it is preservation of muscle mass. Muscle mass is very important when it comes to performance, that's a given, but longevity, we know that the higher your muscle mass as you age, the better are your chances of aging well. Now, this is particularly important for women who are more likely to be taking these medications, simply because women tend to have a lot more issues with their weight in terms of their self-esteem and engaging in weight loss programs and diets and so on. And as women age and go through menopause, the reduced level of hormone is likely to lead to something called osteoporosis. Now, we know that a healthy muscle mass potentially means a healthy bone mass. So if you're a woman taking weight loss medications, please be careful about your nutrition. Another issue with nutrition and these medications is the potential weight rebound once you stop these medications. Now, you see these companies also under lawsuits because they did not mention that you might need to be on these medications forever, because this hunger suppressing effect does not last once you've stopped the medication, and there is a reason why you are meant to increase your dosage throughout the treatment, is because the level of hunger suppression decreases over time as well, even while taking the medications. In studies, they estimate the weight gain rate upon stopping treatment at about 0.5 kg per month. Now, you might think this isn't a lot, but these studies also looked at the beneficial effects on the health of the patients who lost the weight thanks to the medications, and they found that 1.5 years after stopping treatment, these benefits had completely disappeared, and their risk of cardiovascular diseases and injuries came back to their pre-medication levels. So you might think, well, I'll just take a relative low dose forever and be a skinny legend. Well, as I said earlier, turns out these gallbladder injuries, diseases, and cancers are mostly treatment duration and dosage dependent, meaning the longer you are under this medication or the higher your dose, the higher risks are of these issues. So if you are taking weight loss medications, please talk to your doctor about the potential side effects and how you can work together to mitigate those. When it comes to nutrition, we'll talk about it in a second, but first I want to mention peptides. Aren't they lovely? You can get a weight loss medication for a fraction of a price without having to talk to a doctor. Doesn't that sound great? Well, it shouldn't. First of all, I just mentioned the potential side effects. At least if you're working with a GP, you're able to get educated and also mitigate some of these issues. Now, if I was taking a weight loss peptide, that would not be the first thing to scare me. Is that whatever you're taking is only ever as good as who sold it to you. Meaning, this person could be selling you complete doo-doo, but this person probably doesn't even know how that compound was handled or was processed or was made. The main risk that I would be concerned about is hygiene issues when it comes to injecting these peptides into your body. It is not unheard of bodybuilders having extreme infections in the legs or the glutes where they've shot their steroids and chemicals. because of a molecule that was prepped in unhygienic conditions. Now, the main peptide that people have been taking nowadays is called retatrutide. I mentioned it earlier. It is actually being researched by a full-on legit laboratory, Eli Lilly. At this stage, they're on phase 3 of clinical trials. So when it comes to medications, there are 3 phases to clinical trials to see if a medication is safe or not for the public. So you might be thinking, well, sweet, my retatrutide is getting researched. Well, it turns out only about 25 to 30% of all medications get the green light to all 3 of these clinical trials. So I would be careful of who you're getting these peptides from. Most of them will be made in someone's dirty basement or in China. Take your precautions when it comes to injecting that stuff because the consequences can be very ugly. Okay, enough fear mongering. Now let's talk about actual practical advice when it comes to nutrition while taking a weight loss medication or peptide. We said the main issue when it comes to your nutrition is going to be too fast of a weight loss leading to too much muscle mass lost. There's also the issue of potential micronutrient deficiencies if you're under this treatment for a long time. So let's see how nutrition can help you make the most out of your treatment. First of all, starting with calories. There is no reason why you should be in a 1,000 calorie deficit just because you're able to, because you don't have hunger pain. Here, we want to go about it just like normal weight loss, a 500 calorie deficit to start with. So working out your calorie maintenance, and then to that you subtract 500 calories. That's your calorie deficit. Follow this deficit for as long as it's making you lose weight. Track your meals, follow a meal plan made by a nutritionist, and count your calories to make sure that you're eating enough, not too much, not too little. I would not recommend asking ChatGPT to make you a meal plan, not because I sell meal plans, but because ChatGPT is unable to make proper math. Many times before have I tried asking ChatGPT to give me a recipe with this exact amount of calories, protein, carbohydrates, and fats. Never have the math been right. When you add everything together, ChatGPT is always off. Once you've worked out your calories, now we need to work out the macronutrients that comprise these calories. We are going to be eating 1.5 to 2 grams per kilogram of body weight of protein per day. Okay, if you're a 100 kg individual, that's 150 to 200 grams of protein. How do you do that? Well, you include protein at your breakfast, lunch, dinner, and your snacks. Because yes, of course, because you're not hungry doesn't mean you shouldn't be eating 3 meals and 2 snacks. I always recommend having breakfast. Studies show that there is some potential beneficial effects on weight loss to having breakfast, especially a big breakfast. By having a substantial breakfast, you often get to lunch and even dinner a lot less hungry than you would have had you had a low quality or no breakfast or low amount of food at breakfast. So to recap so far, we have a 500 calorie deficit to start with until you stop losing weight, after which you might bump it up by an extra 250 calories, meaning 750 calorie deficit, 1.5 to 2 grams of protein per kilogram of body weight every day, starting at breakfast, also having 3 meals and 2 snacks. When it comes to carbohydrates and fats, most people get enough fats in their diet anyways. A great way to make sure you're getting enough healthy fats is simply eating fatty fish. Salmon, tuna, sardines, mackerel. They are a great high protein snack or meal, and I can't recommend them enough. In terms of carbohydrates, this will depend on your sporting demands. If you're doing endurance-based sports, obviously your carbohydrate intake will be much more higher and important compared to if you just do CrossFit or weight training or you're sedentary. Lastly, micronutrients and deficiencies that might arise through a long treatment or simply a very bad diet. I found this very nice diagram in a paper which explains it all to us. Due to a poor quality diet or quantity or diversity, there are a few micronutrients to be on the watch for. We've got iron and vitamin B12. So iron will be in all your animal food sources. Red meat is the best source of iron. There's also liver and other organs that are very good sources of iron. This is very important for women. If you're a woman taking a weight loss medication, please be careful about your iron intake. Without weight loss medication, without attempting weight loss, iron has the highest prevalence of deficiencies in the world because women menstruate, they lose blood, and this leads to iron deficiencies. Vitamin B12 found in animal products as well. Second set of potential micronutrient deficiencies. The paper tells us that we have vitamin D, calcium, and magnesium that are potentially at risk. Vitamin D, you mostly get it through the sun. If it's winter where you're living at the moment, or if you're going to be in winter at some point, you can go to your pharmacy or GP or buy a vitamin D supplement or get a vitamin D injection. Calcium, mainly through dairy products. If you are vegetarian, then I would recommend looking into fortified plant milks. And lastly, magnesium. This will be achieved through many food sources. Unfortunately, if you're highly active, and we're talking 1 to 2 hours every day, food might not meet your requirement, and this is where a good quality supplement might come in handy. Lastly, we've got zinc and potassium. We'll mostly touch on zinc. Zinc is very important for your immune system and also your hair density and hair health. We see that hair loss often happens in people who have underwent bariatric surgery because they are not able to eat a high volume of food or absorb certain nutrients, and here goes the same for weight loss medications. You want to be on top of your zinc intake if you have issues with your hair. I just realized I forgot to say which food sources you can find zinc in. So zinc is mostly found in animal products. Shellfish and seafood such as oysters and mussels are great sources of zinc. Okay, as a summary, I would be careful about dosages and duration of treatment. This is to be discussed with your GP. Also, before you hop on a medication, maybe contact a trustworthy nutritionist or trainer, whether that's me or other people, to try get you on the right track naturally first, and potentially while you're taking your medication afterwards. If you're taking peptides, stay safe out there. If you need help, reach out as well. Thank you for watching this video. Please like and subscribe. This will help tremendously. Give me a follow at Wholesome Fueling on Instagram. Send me a message with any of your questions, and see you in the next video.